National Registry of Emergency Medical Technicians. Advanced Level Psychometer Examination. Patient Assessment, Medical. Takes or verbalizes appropriate PPE precautions. Scene Size Up. Determines the scene/situation is safe. Determines the mechanism of injury/nature of illness. Determines the number of patients. Requests additional help if necessary. Consider stabilization of spine. Primary survey. Verbalizes general impression of the patient. Determines responsiveness/level of consciousness. Determines chief complaint/apparent life threats. Assesses airway and breathing. Assessment. Assures adequate ventilation. Initiates appropriate oxygen therapy. Assesses circulation. Assesses/controls major bleeding. Assesses skin, either skin color, temperature, or condition. Assesses pulse. Identifies priority patient/makes transport decision. History taking and secondary assessment. History of present illness. Onset. Severity. Provocation. Time. Quality. Clarifying questions of associated signs and symptoms as related to OPQRST. Radiation. Past medical history. Allergies. Past pertinent history. Events leading to present illness. Medications. Last oral intake. Performs secondary assessment, assess affected body part/system, or, if indicated, completes rapid assessment. Cardiovascular. Neurological. Integumentary. Reproductive. Pulmonary. Musculoskeletal. GI/PO. Psychological/social. Vital signs. Pulse. Respiratory rate and quality. Blood pressure. AVPU. Diagnostics blood glucose test, pulse oximetry, etc., as indicated. States field impression of patient. Verbalizes treatment plan for patient and calls for appropriate interventions. Transport decision re-evaluated. Reassessment. Repeats primary survey. Repeats vital signs. Evaluates response to treatments. Repeats secondary assessment regarding patient complaint or injuries. Critical fail criteria: failure to initiate or call for transport of the patient within 15-minute time limit. Failure to take or verbalize appropriate PPE precautions. Failure to determine scene safety before approaching patient. Failure to voice and ultimately provide appropriate oxygen therapy. Failure to assess/provide adequate ventilation. Failure to find or appropriately manage problems associated with airway, breathing, hemorrhage, or shock, hypoperfusion. Failure to differentiate patient's need for immediate transportation versus continued assessment and treatment at the scene. Does other detailed history or physical examination before assessing and treating threats to airway, breathing, and circulation. Failure to determine the patient's primary problem. Orders a dangerous or inappropriate intervention. Failure to provide for spinal protection when indicated.